Hello, Video Nurse here with 5 things that people do that could kill them. Ta-da! We're at the third one now. We've discussed things that people don't do. One of them is they don't read ingredients on the back of packages, and they don't read labels that go along with their prescriptions. Can get them in a lot of trouble. And the second one is indoor tanning. The overuse of indoor tanning can lead to skin cancer, melanomas, and people do die from these. At the lesser end, they end up just putting basically their bum on their nose. That's an Australian marketing ploy that they use to try to get more people to put hats on, to use sunblock, to wear proper clothing in the sun and protect themselves from melanoma. As they said, you don't want to end up with putting your bum on your nose. Okay, so the third thing we're going to talk about is non-essential aesthetic surgeries such as breast enhancement with silicone-based products. You may have heard in the news that silicone was allowed back into the United States for breast enhancement after many people complained that the more water-based non-silicone implants just didn't feel like the real stuff. We're at a real I would say a breast-obsessed culture in the United States. You can watch any MTV video and see that every woman out there has got a push-up bra on, and the focus is on this overt sexuality that they're wearing on their chests. And so I like to laugh about it and say, okay, it's a bunch of people who have been convinced that by putting their butts on their chests, they look better. Okay, I'm not arguing with that. If that's what makes them feel better, fine. It's putting silicone inside their bodies that's the problem. See, do you know where this comes from? Do you know who the first people were that started putting silicone into their bodies? This is a World War II behavior. And it was started among the geisha and the prostitutes in Japan, who were trying to make money by attracting American GIs to, do business with them, if you want to call it that. And so to make their breasts look bigger, they actually injected silicone into their breasts. And of course, all these ladies died at a younger age because that will kill you. All right. One of the things we know for sure about silicone breast implants, or any breast implant for that matter, is that the skin that it's in is going to eventually break down and leak. So anybody who decides to get breast enhancement must consider that they're going to have several surgeries over the life of that, fake breast inside of them to maintain the look and the feel and their health, because it will leak. They do shift. There's just no way it's going to stay the same. And some of the outcomes of getting breast enhancement of any kind is a dimpling or wrinkling of the skin. So things that people should consider before they're going to do something like this, even if they're really, really set on it, or they've had a radical mastectomy for cancer, and they feel that, whether they're lopsided, if they had a double, okay, both breasts have been cut off, but they want to have some look and feel of their natural breasts again, is that when you have this surgery, one, you permanently damage the breast tissue that's there. So if you decide to have those implants removed, your breasts may never return to what it was before surgery. They're going to be dimpled, they're going to be wrinkled. That's just the bottom line. These implants, whether silicone or not, are going to change the appearance and sensation of the skin there. That's just going to happen. Associated health problems. Some studies have found associations between breast implants and certain health conditions, and here's one of the more disturbing ones. It said that several studies, one of the studies I read, found an increased risk of alcoholism, drug abuse, and suicide in women with breast implants. And I thought, WTF? What is that about? Okay, what the study itself wrote it off is they said these women who were getting the implants already came in with these problems. So there may be, one group that's already suffering from this, and the doctors basically took their money and put implants in them, hoping that they feel better or have better self-image. Honestly, that won't improve your self-image. The person inside, in here, is still adjusting to whatever just got put out here. Okay. So, and this is true for people who say lose a huge amount of weight. They can lose 140 pounds, become this whole other person, but still inside they're the same person. And so they're going to have some stuff going on upstairs that complicates the whole picture, and they may not improve their self-esteem by it. So one of the things that people do, is they try to feel better about themselves by getting these kinds of surgeries, even if it's not reconstructive, just aesthetic. And a lot of them end up being really unhappy with that choice afterwards. And thousands of dollars later, they realize they put themselves at risk. They spend a lot of money, which puts a lot of financial strain on them. And for what? Oh, great, I got to go and remove them anyways. So really, really caution your friends and loved ones who are considering doing this to really, really think it over and go outside of just the surgeon who wants to do this and says that it's safe. Do a little research, and don't just go to those websites that are promoting these surgeries, because of course they're going to have a conflict of interest as well.